Okay, in this chapter we're going to talk about skin cancer, burns, and some of the developmental and aging aspects of skin. Now, we can't cover all of the disorders of skin because there's thousands that can develop. But what's interesting, though, is that many internal diseases can reveal themselves on skin. These might be autoimmune, where the immune system can attack, deeper tissues, but they can also present in skin. An example of this is like lupus. Or other infectious diseases, which are pretty common. But some of the least common but also more damaging can be things like skin cancer and burns, which we'll go into more detail in this lecture. So skin cancer can be a group of life-threatening growths of skin cells. Now, most skin growths are just tumors, which are benign and therefore not cancerous, and they don't spread or metastasize. However, if it's cancer, they're growths or tumors that are metastatic and therefore cancerous, and they're more dangerous because they can spread to many different organ systems. Now, some of the risk factors for skin cancer include things like overexposure to ultraviolet radiation and other forms of radiation. Frequent irritation of skin can also lead to cancer. And some skin lotions actually contain enzymes that can repair damaged DNA, which is actually pretty cool. Because let's say if you get a sunburn and you're worried about that the UV radiation from that sun exposure may have damaged your DNA, there are lotions now that actually contain enzymes that can repair damaged DNA. Now, there are three major types of skin cancer we'll talk about here. We got the basal cell carcinomas, squamous cell carcinoma, and the least common but most fatal is called melanoma. Now, basal cell carcinomas are the least malignant but also the most common. And they're most often going to be benign growths of the skin. And specifically, the stratum basale cells proliferate and slowly invade the dermis and hypodermis. They are typically easily cured by surgical excision. And excision just means to cut out. And this is true of 99% of basal cell cases. Now, basal cell carcinoma is going to look like a small rounded projection with a pearly appearance, which may be pitted, and they're fairly common, and it's considered a growth within skin, and they're least likely to become cancerous. Now, squamous cell carcinomas are the second most common type. They also can metastasize, but they're much less likely to metastasize than, let's say, melanoma. It involves the keratinocytes of your stratum spinosum, hence the name squamous cell carcinoma. And it's usually kind of a scaly, reddened papule on the scalp. Papules are going to be small, rounded projections. And you can find this on the ears, lower lip, or hands, because these are the areas of our face that are more often associated and exposed to UV radiation from sun. Now, you get fairly good prognosis as long as it's treated by radiation therapy or surgically removed. And what the squamous cell carcinoma looks like is basically this sort of reddened or erythematic, flaky, scaly kind of appearance here. This is probably somewhere on the scalp. And you can see here, this is just a pretty typical example of squamous cell. Now, melanomas are cancers of the melanocytes. Remember, the melanocytes make melanin. Now, these are considered the most dangerous type because melanocytes are more often likely to metastasize and spread throughout the body, as well as be resistant to some of the drugs we use to fight cancers, like chemotherapeutic drugs. Now, it's treated by a wide range of surgical excision. You're talking about you're actually going to have pretty large margins of cuts to remove that tissue that may contain the melanoma, that also go very deep. And this may be also accompanied by immunotherapy to help improve your immune system's ability to attack these melanocytes. Now, the key to survival for melanoma is early detection. You want to detect these growths before they have the potential to get large enough or spread around your body. And we actually use this ABCD rule. A refers to asymmetry. If the darkened patch of skin, which you might think is a mole, it has kind of odd or irregularly shaped boundaries and therefore asymmetrical, this is not a good sign. B stands for border. So border irregularity means if it doesn't have very clear margins, if there's kind of hazy borders or exhibits indentations. This is also, one of the risk factors for melanoma. C refers to color. So if it's bicolor, like if it contains many different colors within that growth, like if it ranges from black, brown, and tan, or red or blue, this is also not a good sign as well. It's better to have, growths that have a more of a uniform color. And then diameter is also something to consider. So growths that have a diameter larger than 6 millimeters, which is about the size of a pencil eraser, these would need to be evaluated for the potential of melanoma. So melanomas can appear like this. Remember, we use the ABCD rule. So you can see that this is much larger than 6 millimeters. You also see that it's actually fairly dark, like much darker than a mole would normally be. It has it's asymmetrical in the sense that it's not, a mirror image on each side. And the boundaries are fairly clear, but there are some indentations here which could also be a sign of melanoma. Now, not all melanomas look like this. Sometimes melanomas just look like the tiniest little mole on your skin. And sometimes melanomas aren't even dark because some melanomas don't produce melanin normally. So they're still melanocytes, but they don't produce the pigmented molecule melanin, so that the melanoma can actually be, just skin color. Now, in terms of burns, it's actually tissue damage caused by heat, electricity, radiation, or chemical exposure. And this is actually caused by damage that leads to denaturation of proteins, which means that they are misfolded, and this can also destroy cells irreversibly. The most immediate threat from burns is dehydration. Because remember, one of the major functions of skin is to prevent dehydration or water loss, as well as electrolyte loss. If you lack skin because of a burn, then this is going to be a weeping wound that's going to lose a lot of water through dehydration, and that water is going to carry electrolytes with that, so that individuals who have large burns can dehydrate or undergo electrolyte imbalances. This can lead to the shutdown of your kidneys and even lead to circulatory shock, where you don't have enough blood pressure to maintain adequate blood flow to your body's organs. Now, to evaluate burns, we use something called the rule of nines. Now, the rule of nines is more of an approximation of total body skin surface area. And we can use this to estimate the volume of fluid loss that may occur in response to, a particular burn. But we can break down the body into 11 different sections, and each of these sections represents about 9% of the body's surface, except for the groin area, which would be about 1% of total body skin surface area. So what this slide is showing is basically just percentages of skin surface area as a fraction of the whole. And so you can see that on the anterior head and neck, that represents 4.5%. So the entire head and neck would be 9% of your total body skin surface area. The entire upper appendage is also 9%. However, just the anterior part is 4.5%. The anterior trunk is 18%. So the entire trunk, posterior and anterior, would be 36% of your skin surface area. The perineum or groin is only 1%, and then each lower appendage is 18% total, with 9% on the anterior and 9% on the posterior side. So we call this the rule of nines because these are typically numbers that just are divisible by 9, or factors of 9. And we can see that if you tally this up, it leads to 100%. Remember, this is more of an approximation because people's body types can vary, and the proportion of skin surface area isn't going to be constant from person to person, like on an upper appendage. However, it gives us a very rough approximation that can help clinicians, especially emergency medical staff, to determine how much fluid loss may occur. So, for instance, if you know that someone burned only their anterior thigh, that's going to be about 4.5% of their total body skin surface area, right? Because if their entire thigh and leg is 9%, or lower appendage, anteriorly, then half of that would be 4.5% here. And we can use that number to understand, well, how much fluid are they going to need to maintain, adequate blood volume. So we can classify burns based on severity. And we have first, second, third degree burns, as well as a fourth degree burn. First degree burns only damage the epidermis. So you see localized areas of redness, edema, swelling, and pain. And we typically think about first degree burns as only damaging the epidermis, right? So not deeper structures. So it's just more of a mild irritation of the skin. Second degree burns include the epidermis and the upper dermal areas. These are the ones that are more likely to blister and can lead to first or second degree burns, are referred to as partial thickness burns. But these can be painful because of nerve involvement and may blister or bleed because you've damaged the dermis. Now, third-degree burns are full-thickness burns, where you've gone through the entire epidermis, through the whole dermis, and because of this, the skin is going to look kind of a grayish-white or cherry red or blackened. You don't find edema because, and also these wounds are typically not painful because of damage to blood vessels and nerve endings. And because these are so deep, skin grafting is usually required. And these skin grafts can come from yourself, they can come from animals, they can come from amniotic lining, or even cadavers. So what we see here is just an example of first, second, and third degree burns. So first degree burn would just be more of a mild irritation of the epidermis. So you see localized redness and swelling here. Second degree burns are more likely to blister and be painful because of damage to the dermis, and so blood vessels are more likely to be leaky, which causes your skin to blister here. And then third degree burns are deep. There's a full thickness burn. You can see that the skin is burned all the way through here, and you're actually looking at subcutaneous tissue. This is not skin anymore, because this is the skin layer here. You've gone all the way through skin, and this is all just subcutaneous tissue, so it's considered a third degree burn. Now, a fourth degree burn is actually going to be down into muscle and bone, and that's how that's classified. Now, burns are considered critical if 25% of your body has second degree burns, or if about 10% of your body has third degree burns. It's particularly worse if the face, hands, or feet have third degree burns because of immobility. And treatment for burns can include things like debridement, which is removal of burned skin, antibiotic therapy to prevent infection, temporary covering, which could be things like gauze or even artificial skin, and maybe even skin grafts from the same individual or other animals or a cadaver. So other developmental aspects of the skin are just kind of interesting to talk about because, in terms of fetal development of skin, you find that the skin of the fetus is fully developed by the end of the 4th month. Now, we have different types of words we use to describe developmental stages, like there's a lanugo coat, which are just delicate hairs that develop on the fetus in the 5th and 6th months. And then there's the vernix caseosa, which is basically a protective layer of oil that surrounds the skin of the fetus, which protects the skin while the fetus is submerged within the watery amniotic environment. Now, during infancy and childhood, skin thickness and skin will thicken, gets thicker. It accumulates more sebaceous fat, as well as sweat and glands can increase. Now, in terms of during teenage years, you can see things like the development of acne due to increased activity of sebaceous glands. Skin has optimal appearance during the 20s and 30s, but after age 30, the effects of cumulative environmental assaults start to show on skin, so that wrinkles show and skin can become thinner, or you see more localized area of damage with moles or freckles. Also, as we age, scaling and dermatitis become more common as well. Now, in terms of aging effects on skin, we see that epidermal replacement slows so that the skin actually becomes thinner. It can be drier and itchy because of a decrease in sebaceous gland activity, and subcutaneous fat and elasticity also start to decrease, so that you find that individuals are more cold intolerant and they have more wrinkles here. There's an increased risk of skin cancer due to the lifetime and cumulative effects of UV exposure. And there's also hair thinning throughout skin. Now, these are all important considerations because if you think about how if skin's less of a protective barrier in elderly, then they're more prone to injury, so because their skin is weaker. Now, the ways to delay skin aging are to have adequate UV protection, good nutrition, maintaining adequate fluid, and good hygiene over the course of your lifetime.